Thank you, Mr. Chairman, and thanks to Chairman Carter and Ranking Member DeGette. I am glad to be back on the Health Subcommittee this Congress. And I thank all of the witnesses for your testimony today. It has been very helpful and important, and I appreciate your perspectives, your passion, and your purpose. So thank you all. During this hearing, I've heard my colleagues on both sides of the aisle express concerns about the overdose epidemic and about combating illicit drugs in this country, and I think that these concerns are sincere. Ms. LaBelle, I think you provided a really important overview of the interplay of complex challenges and the many fronts on which we must combat the existing and emerging illicit drug threats. But what we have seen in just the last few weeks from the Trump administration undermines efforts to address this challenge as you described them. Undermines isn't actually a strong enough word. What the administration has done in the last few weeks is really decimating our efforts and our ability to respond and address these complex challenges. Certainly, efforts to disrupt international supply chains requires robust collaboration with law enforcement partners. So firing FBI and CIA agents and outing them is making us all less safe and less able to combat these illicit drug threats. Gutting the federal workforce, of course, affects not only those and other law enforcement officers, it also affects the entire healthcare system across the United States. Halting all federal funding, including funding for the NIH, the largest funder of biomedical research in the world, which funds critical research on substance abuse and addiction, also impedes our ability to respond. And as Dr. Ruiz noted, the administration has also halted funding for SAMHSA, Substance Abuse and Mental Health Services Administration, the main government agency tasked with improving mental health across the country and addressing substance use disorders. And following up on some prior exchanges today, the only reason these funds are now available to grantees is because multiple federal courts have blocked the administration's actions. And even though that freeze of funding has been blocked, we are hearing reports today that the SAMHSA website has been inaccessible. This website has critical resources that can help our constituents find the help and support that they need. And our job as members of Congress and as members of this committee is to tackle these complex issues thoughtfully, to tackle the things that we're talking about today and craft legislation that helps address them, to find a legislative solution to address the supply of drugs entering the country illegally, to take measures to make the public aware of the threats of these illicit drugs, to address substance abuse disorders by expanding access to prevention and treatment programs, and to find research, to fund research for new treatments and new innovative ways to address the crisis. We say we are doing that today with this hearing, but what is this committee doing? What is this Congress doing to assert its authority here over congressionally appropriated funds and congressionally established agencies and programs as President Trump and Elon Musk stop payments, eviscerate programs, and fire qualified personnel? Ranking Member DeGette noted that in the last Congress, Republicans failed to bring the SUPPORT Act to the floor. And as a reminder, the SUPPORT Act was a bipartisan agreement that would have extended scheduling for fentanyl-related substances and reauthorized programs for the prevention and treatment of addiction. It was included in the bipartisan continuing resolution last December. But then Elon Musk tweeted that he didn't like the CR. And that was that. There was no SUPPORT Act. So why are we here? If Elon Musk can at any time substitute his judgment for all of ours at a moment's notice without any meaningful objection from the House majority. If we pass a bill to address the overdose crisis, or any bill, how do we know that the Trump administration or Elon Musk won't just cut off any programs or any funding that we authorize? I hope this committee will assert its jurisdiction to the executive branch. I hope that this Congress will assert its authority to the executive branch. As we have seen from the testimony today, the stakes are too high for us to do anything else. Now, with the time I have left, which isn't much, I do want to turn to something that we expect this committee to take up, and that is Medicaid. And one of the current attacks on federal funding, Republicans have outlined in their budget reconciliation is a proposal to cut $2.3 trillion in cuts from Medicaid. So, Dr. Kamengaya, in your testimony, you talked about how we should increase funding for Medicaid. Can you just discuss with the time left how you think significant cuts to Medicaid may harm our efforts to combat this epidemic?
Cuts to Medicaid harm children. That's the period in the sentence. 50% of children are insured by Medicaid. That's how they receive health care. So AAP is very concerned about cuts to Medicaid.
Well, thank you. I've gone over my time. I have a few more questions I will submit for the record, but I thank you all again for your testimony and your time here today and your work. Thank you. I yield back.